Here's why I think hospice is difficult to understand. It's not accessible. What do I mean by accessible? When you need it, it's very hard to find it. And it's very hard to understand it, because when you're trying to understand it, you're understanding it in a very focused, narrow lens. And it's like me talking to you like this, and you're not able to understand what I'm saying. All right. So I want to take this time to help you understand a little bit about hospice, because it can get really confusing. And a lot of times when we're talking to family members about hospice, they're in it, and it's very hard to wrap your mind around it. And so I want to take this opportunity to really walk you through what hospice is when you're not as stressed, because it's knowledge is power. And it's good for you to know some things. So let's walk through it together. Okay, so let's keep it pretty simple. What is hospice? Well, hospice was made and initiated by Medicare with the goal of treating patients with a terminal diagnosis of 6 months or less to live, keeping them comfortable, helping them pass with dignity and respect, and having the resources that's needed for them to be stable and comfortable at their place of residence. Their place of residence could be at home, it could be in an assisted living facility, an IL, or a skilled nursing facility. And the goal is to keep them comfortable and give them the opportunity to pass with dignity and respect, but also have a whole bunch of support so that they don't pass by themselves without any help. And so think of it this way. When you have a baby that's born, there's a whole bunch of people around the baby to help support, bring that baby to life and to bring them into the world. If you really want to look at it that way, it's almost the same when it comes to hospice care. There is a whole bunch of people. There's nurses, there's doctors, there's social workers, there's chaplains. There's a whole bunch of people around that patient to help them transition peacefully with dignity and respect. And it takes a lot of people to do that. And that's the same comparison that you want to look at it when you're looking at birth and you're looking at death. Birth and death, kind of the same thing. All right, so how do you even start hospice care? How do you get hospice care? So there's several different ways, but the most common way is usually a doctor will write an order and say, hospice evaluate and treat. Maybe it's your PCP, maybe it's your oncologist, maybe it's your whoever the doctor that you're working with closely. They may say, hey, I think it's time for either mom, dad, or whoever your loved one is to get hospice care and to get an evaluation. Or if you're in the hospital and something happened and you're at the hospital and it's getting worse, the doctor at the hospitals that's there may say, hey, I think it's time for hospice. And now hear me out and hear, physicians and doctors, nobody knows when someone's going to pass. But they write that order because they say that maybe 6 months is just an estimate. It could be a year. They don't know. But the goal is to keep that patient comfortable and let them have enough support so that they're not going back and forth to the hospital. They're not going trying to do so many different procedures and things like that. It's the support. So when you see a doctor that's writing an order for hospice care, they don't know. No one knows when someone's going to pass. Only God knows. But the order is to evaluate and to assess for the need of hospice, for those services, for those benefits, for the comfort, for the supplies, for the DME, for the medications, for all those things to help that patient keep them comfortable, to help them through that process if the disease is taking such a really, really bad toll on their body. And so that's one way. Another way is you can actually call a hospice at any time and ask them for an evaluation. You, your loved one, they could send out a nurse practitioner to do a face-to-face assessment and lay eyes on your loved one and see if they qualify. Of course, they'll probably coordinate with your PCP or any doctors to get some clinicals, to get demographics, some most recent progress note that'll help them see what's going on with your loved one to see if they qualify for hospice care. Okay, so now let's talk about the qualifications of hospice care. So just like anything, there's rules, and rules have to be followed. In order for someone to be eligible for hospice care, there are these determinants, and they call them LCDs. These determinants tell the hospice whether or not this patient will qualify. There's different specific diagnoses, like everyone knows Alzheimer's. Everyone knows cardiac diseases like hypertension or CHF, you got COPD, you've got all these different diseases. Now, all these categories are all the LCDs. And then there are some that are not disease specific, but there are so many things that can contribute to a decline. Not able to ambulate or do ADLs, which is activities of daily living. There's a huge decrease in their weight, their memory, their cognitive ability, just so many different things. All these things can paint the picture to where they're not able to do the things that they used to do, which can qualify them for hospice care. Now, when a doctor writes an order, the doctor who is not specialized in hospice care writes an order to evaluate and treat. Now, it's the job of the hospice to qualify your loved one for hospice care underneath those diagnoses and underneath those LCDs, in coordination with the hospice doctor who oversees the hospice care. The question people have is, wait, there's a hospice doctor now? Yes. There is a hospice doctor who specializes in hospice. That's what they do. Now, that doctor will oversee the care for your loved one and be the main primary doctor. Now, you can choose your PCP to be what they call an attending, or you can choose that doctor to be your doctor, to be the doctor. But a lot of times, when it comes to end of life, most of the time those doctors will defer to the PCP, will defer to the hospice doctor, so that they can oversee all of the care when it comes to the hospice terminal diagnosis. So medication management, at end of life, coordinating with the nursing team, it usually defers to that hospice doctor. And so, look at this little guy. He's shooting pretty good. Chilling at the park, trying to make it simple for you guys. But yeah, so that's the hospice doctor. The hospice doctor is the one who oversees the care. And now that doctor has to qualify your loved one or the patient for hospice services. All right, so let's say your loved one qualifies for hospice services. Now an admission starts. So within hospice, there's these areas or benefits. So you've got the ability to receive supplies. You've got the ability to receive durable medical equipment. You have the ability to receive medications delivered to your doorstep. These are all covered underneath Medicare through hospice care. And so the nurse who comes and does the admission will lay eyes on your loved one, do a head-to-toe assessment, review medications that will be covered under hospice and non-covered, which means that the covered medications will be underneath the terminal diagnosis and the main reason why hospice was started. And then anything that's non-covered would be, sometimes you've got cholesterol medications, vitamins, things like that won't be covered under hospice, which will then revert back to your insurance Part D. And so that nurse is going to do that initial assessment and create a care plan. That care plan is going to be the guidance of how many times the aide may come out, the chaplain, the social worker. These are all services. You can say yes or no. You don't have to have these services, but it is a benefit to you and to your family. And then the nurse is the quarterback and kind of dictates the pace. Now, this is what they call routine care, which is normal care. So it's the day-to-day routine care that happens for your loved one. And then there's another level, which they call continuous care. And so that's when a nurse will come and assess the need for someone to be at the bedside. Now, there's a whole bunch of metrics and measures that have to be met based off of your loved one having some issues with pain or not safe by themselves. And the nurse will then qualify in coordination with the hospice doctor to see if they qualify for continuous care. A lot of times what we see is that there's this gap between the routine care and continuous care. So a lot of times what we see families is if they need help, they may do private pay in between those times, because the aide, when they come out for usually 30 minutes to 45 minutes to an hour to help with bathing, and that's it. Now these things are covered by Medicare. This is free, right? So if there's anything else you want outside of that, it usually is paid out of pocket. And that can happen. You know, you get a lot of these services, and then some of you need extra things, and you pay out of pocket, and you can really allow for your loved one to be at home and to be comfortable and to pass with dignity at home. So now all these things are covered. You got the routine care, and you got the respite care, which is another sector that allows for hospices partner with facilities in the area, and they can basically transport your loved one to a facility for 5 days where you can rest and get respite, and then they transport them back. And then you've got GIP, which is General Inpatient Unit, which hospices usually contract with a skilled nursing facility or an inpatient unit, so that if your loved one is not doing too well at home and getting worse, or they can transport them to a general inpatient unit as well. So, you know, those are all like the 4 areas of hospice care. But really and truly, that's hospice in a nutshell. I know that's kind of really basic, but if you want some more in-depth information on hospice care, please feel free to check out more things on our YouTube channel. But I hope this helps you. Hope this is a comfortable setting for you to at least understand hospice, because just like anything in life, knowledge is power. And if you don't know how to cook chicken, you're not going to be able to know how to cook chicken. Yeah, that didn't make sense. If you don't know how to cook chicken, you don't know how to cook chicken. You know what I'm saying. Knowledge is power, and so it's important to know things before you get into a situation, and then you have to scramble to find the knowledge or find the information that you need. So hope this helps you. Be blessed, and yeah, let's continue to walk this journey together. Kids playing, having a good time. It's nice outside. Peace.